First off, there's two types of wisdom teeth when before the surgery. Impacted, these are impacted. And this is the gum line right here. And impacted means that they're below the gum line, and most of the time they're in the bone. The second one is erupted. And that's just, they're above the gum line like your normal teeth, and they're a lot easier to take out. Unless the teeth are erupted, the patient will be sedated. And we have 3 different types of drugs that we use. The first is a mixture of Valium and Demerol, and that just makes the patient feel relaxed and high. And the second is Brevitol, and we give them about a minute on the Valium and Demerol, and Brevitol basically knocks them out. It's when the dentist has you count down from 10, and after they're asleep, it takes about 15 to 20 minutes if things run smoothly to complete the surgery. And the first thing the dentist will do will cut an incision with a scalpel above the gum line, right above or if they're impacted, he'll cut it right in the gum line to expose the tooth. And he'll use a scalpel for that. And he'll use the drill. He'll cut right here, and then the drill will be used to go around the bone and expose the tooth. And once the tooth is exposed, he'll use a tool called an elevator, and it has a handle, and it kind of wedges itself like a paint can. And you know how you take like you take something and you wedge the paint can top off, and then it pops out. And if it's elevated, you don't have to use the drill at all. But if it's in there real deep, you take the drill and he'll cut it into multiple pieces. And the hard thing with that is that the root will get stuck down there sometimes, and it takes a lot of work. But once the tooth is loose enough, there's 3 types of scissors that are used. And the first is a skinny dull pair, and it has a curved tip, and that's used it grabs the tooth like that. And the second pair is a long, and it's dull, but it's the longest pair, and it's straight. And that's used to, it grips the U-shaped needle of the suture. And once he sutures it up, he holds the tooth, he grabs the tooth out with that, he sutures the gum up, and then the last pair of scissors is a small one, it's pointed, and that cuts the suture. Once the surgical part is done, the follow-up takes place. We give the patient about 5 minutes to come to it, and as like someone's cleaning the dishes, they'll call the caretaker of the patient back, and we'll go over the steps with them. And we give them kind of like a goodie bag, and it's filled with gauze, sterile gauze, and an ice pack, prescription, and an aftercare sheet. We go over the sheet with them, tell them no solid foods. You can eat mushy foods, but just don't try to chew with your front teeth. And be sure to change your gauze out regularly, but not too much, because you want bleeding to occur, because the oozing is pretty good for it, but you don't want to dry it up, otherwise you could get a dry socket. Dry sockets are when food or something gets caught down in between like the suture. And those don't really happen often, but they do happen sometimes when people are careless. No smoking, no dipping, which a lot of people think that you can dip once you get your wisdom teeth taken out. After the patient is able enough to stand, they're escorted out. They can't walk on their own because everyone feels like they can do everything and they're okay, but they're really not. Like, a lot of people get emotional after surgeries too, And a lot of guys, it's funny, guys think that they're all big and bad and everything, but then they end up crying and asking you to hold their hands. Wisdom teeth surgeries are not as bad as you may think they are. In fact, most people need them. The majority of people don't remember anything about them. But according to Dr. Brummeth, the author of Your Dental Health, it takes an average of a young adult about a week, 5 days to a week to fully recover, as opposed to an older person in their let's say early 30s, late, whatever. An older adult takes up to about a month or two to recover.